Hi, I'm Dr. Ellie Phillips, and in this video I'm going to tell you the real reasons why you think you inherited bad teeth. There are three reasons. There are the lifestyle habits that maybe you learned either as a child or you are practicing as an adult. There are the facial structural things that you can do things about. They may be genetic, but they don't have to define your oral health. And thirdly, bacterial transfer, which is something most people don't understand, and you can control the bacteria that you pass as a parent to your children and between children very easily. I talk to so many people who believe they inherited bad teeth or bad gums. And what I do with these patients is show them with my strategies how they can stop the problem and turn it around and oftentimes actually repair the damage or at least stop it from continuing. There is no reason to feel so disempowered that you just think you inherited soft teeth, weak teeth, fragile teeth, or bad gums. You have the power with the correct strategies to do something about it. Why does this occur? Why do you look back in your family? Maybe it's your parents or your grandparents. Everybody in the family had bad teeth. Well, there are reasons. It's not just a genetic thing. I know dentists tell you that a lot of things in dentistry are genetic, and I would debate that. But there are things that we pass along from parent to child, from grandparent to children. And one of these things are habits. You know, if every time you met your grandma, she took you out for a sweet treat, you may love sweets. And that, of course, the sugar feeds the bacteria that can cause cavities and plaque buildup and so on. And so habits, lifestyle habits, these are the things that we learn oftentimes from our parents. Did your mom sit with a cup of coffee in her hand for hours and hours? Maybe you're readers, you are a family that likes to read books and sip drinks at the same time. These are habits that are bad for teeth. And so looking at your daily habits are one of the things that we do on my boot camp. We look very carefully what I call the day in the life of your tooth. Other habits, things like when you brush your teeth. Your mom may have made you get out of bed and brush your teeth immediately. Then you went downstairs and had a sugary cereal for breakfast. That does no good at all to your teeth. So changing some of these small habits can make an enormous difference. The other difference, of course, that I recommend people use is xylitol, because even if you don't have time to clean your teeth after, say, a sugary breakfast, there are things you can do by eating, for example, a couple of xylitol mints that will take away the damage from that sugary breakfast. So just because you love the habits you have, there are ways that we can very gently and easily tweak these things so that you no longer damage your teeth and change the outcome for your oral health. By the age of 4, the bacteria in your mouth are pretty much a blueprint for what's going to happen next with your teeth. If you have horrible teeth at age 4, unless you get on a good program with xylitol and changing things, there is a very high probability that you will be an adult with bad teeth. It's just the way it is. We have data to suggest that. We also know from studying the bacteria in children's mouths that those bacteria that are in a child's mouth at age 4 create 40% of the biofilm, the main portion of bacteria in an adult's mouth. So how your teeth were in childhood has a huge influence on the kind of oral health you can expect in later life. Again, this can be modulated. It can be slowly changed with correct strategies. But I'm just here to say it wasn't an inherited gene factor as much as the fact that maybe your mom allowed you to snack on apple juice or sugary sweets, and that's how it all began. So it was more of the lifestyle and very little of the genetic. However, there are genetic factors that definitely come in. The arrangement of your teeth. I'm sure if you have a family with a big smile, everybody has a big smile. If you have a family that has somewhat crooked teeth, that can also be somewhat inherited, the shape of your teeth in the shape of the jawbone. Besides that, the other genetic factors that are most prevalent, and I see a lot, are people who have a slightly shorter upper lip. Their lip doesn't close very well over their front teeth. If your lip doesn't close well, your salivary flow in your mouth doesn't flow very well. It doesn't coat those front teeth. They kind of get dry every time you talk and breathe, unless you make your lips seal. And some people, their lip is too short for that to even happen. Then your teeth are going to get dry. And without the protection and the nurturing of the liquid in your mouth, your saliva, then those teeth are much more likely to decay. That may have happened to your mom, grandma, now to you. This is where you can see the patterning that makes us believe it's genetic. But it's actually, if we looked at anatomically, it is either the jawbone shape or structure. Maybe your upper jaw is further forward from your lower jaw, so your mouth doesn't close very well. Just because you have a shorter upper lip, or just because your jaws don't fit together so that you can close your lips, doesn't mean you have to have another generation of dental problems. Again, I go back to the fact that I have strategies that work for everybody. You may just simply have to lick more of the saliva around your teeth that get dry, and that's the way that you'll protect them. So there are the bacterial things that you pass along from your baby teeth into your adult mouth. There are habits that we so-called inherit, or we certainly learn early in life. And then there are some structural, anatomical things that do depend on our genetics. And then there's one more factor that I think is very misunderstood, that women's mouths, especially young women, they are at far greater risk for tooth decay and gum disease than male counterparts. And this is because of the hormonal changes that occur. And with these hormonal cycles come changes in the pH, in the acidity level of women's mouths. When you are pregnant, for example, your mouth is going to be acidic for 9 months. It doesn't matter what it is normally. When you're pregnant, measure any pregnant woman's mouth and it will always be a pH that is lower than 7.4. 7.4 is the pH of good, healthy saliva. And it's the ideal pH for the putting back of minerals from your saliva into your teeth. That is how our teeth stay healthy. Every day, the liquid in our mouth brings these minerals and deposits them into our teeth. When you're pregnant, first of all, the pH is wrong. It's the wrong pH for that to happen. It's a pH or an acidity level that is doing the opposite. It is pulling minerals out from your teeth, weakening them, making them softer. And this is why you may have heard the story that people say, I lost a tooth for every pregnancy. It wasn't the pregnancy per se. It was the fact that the pregnancy hormones changed the acidity levels in the mouth and create a higher risk factor. And this happens cyclically for women throughout all of their lives. Menopause does the same kind of thing, only it's a little bit more powerful because it's often with mouth dryness occurring at the same time. So when you are in a state of acidity, when you don't have healthy saliva to help you rebuild your teeth, guess what happens? Your teeth deteriorate. The other thing acidity does is it grows harmful bacteria that form plaque. And the plaque bacteria irritate your gums, open up pocketing. You're at high risk for gum disease. Now, it's not necessary, and everything I teach in the strategies that I teach, and I am a woman. I have been pregnant 5 times. I have a grandma status now. I have gone through these years without damage. So I know that the strategies I recommend will work for you. But I'm just saying, it's really easy to believe the stories that you're given if you don't understand the science behind how teeth repair, how teeth deteriorate. And it's kind of like a teeter-totter. The mouth is always trying to help you. But if you don't help it at certain stages, it is insufficient. It doesn't have enough power. So by empowering you, you can then help your mouth to basically heal itself. And the strategies that I teach, as everybody who's watched any other videos knows, I am a huge believer in xylitol, because xylitol stimulates a flow of saliva into your mouth that is at the right pH or acidity level or non-acidity level for it to repair your teeth. The other thing that xylitol does is it feeds good bacteria in your mouth and gets rid of plaque. And when you use xylitol over a period of 6 months, the plaque-forming bacteria, literally the bad bacteria, disappear. Now, years ago in 1970, they did a study with pregnant women, and they gave them xylitol. And what they noticed was that over the last 3 months of pregnancy, they reduced the amount of plaque in these women's mouths. And then the 3 months when their babies had been born, by the time the baby was 3 months old, these women had 98% of the plaque in their mouths gone. So their mouths were full of healthy bacteria. When these women interacted with their children, with the babies, then the teeth of the babies were covered with good bacteria. And then the researchers actually left the country and went back every year to check on the children of the mothers that had used xylitol towards the end of their pregnancy and the first year of the baby's life. The children had never had xylitol. This was simply to prove the transfer, the importance of the transfer of good bacteria from the mothers to the babies. Well, lo and behold, the researchers went back, and at 6 years old, those children had 85% less cavities than the rest of the population. This was a study in the 1970s. They then went on and did more and more studies showing that if you give xylitol to children in addition to helping the mother, you get virtually 100%, 98% risk factors gone. So why wouldn't we be doing this? More recent studies in Malawi, they gave 2 pieces of xylitol gum to pregnant women, and it reduced their risk of preterm birth. And we all know that preterm birth has nothing good to offer young babies. It simply creates more breathing problems, more health problems, more risk for the baby. So taking care of mothers' maternal health is a huge goal of mine, because I believe that by doing that and helping mothers understand the power they have to control their own mouth bacteria, they can then pass that along, physically pass good bacteria in droplets of saliva. It is not genetic. It is literally a transfer in these droplets of saliva as we kiss, hug, share space with our loved ones. We share these bacteria from our mouths. And then the children's teeth get infected or colonized, as it's called, with good bacteria. And lo and behold, the rest of their lives have a whole different story. So be encouraged. This is really something that you can get your hands around and change the outcome, not only for you, but for the future of your family.